Hello, my name is John Cox, and I am a FNP student at United States University, and today I will be presenting on a 72-year-old female who presents with the chief complaint of cough, and that is productive with green phlegm ongoing for the past 2 days. She reports the cough started about 2 days ago and is productive. She describes the sputum as green in color, denies any associated fever, chills, or night sweats. Patient currently is denying any chest pain, palpitations, or shortness of breath at rest, though she notes that she does have a slight increase in breathlessness and with moderate activity. So there's no history of sick contacts. She hasn't had any recent travel, and she is a lifelong non-smoker. And her husband, who she lives with, does not smoke either. She has been using over-the-counter guaifenesin, and it has not helped or improved her the mucus or the cough. She does have a past medical history of hypertension, and it is controlled with lisinopril 10 milligrams daily, no known drug allergies, and regarding her social history, she does live with her husband. She gets around on her own. She still drives. She is a retired school teacher, and she does not use tobacco. She does report that she does on occasion use alcohol, but it's not a daily thing. It's generally holiday events and things like that. She'll drink some wine. Other than that, on the physical exam, the MA got the vital signs for me, and the vital signs were 138/84 with a heart rate of 88, respiratory rate of 16, oral temperature was 98.8, and 98% on room air. Patient is alert and oriented ×4, Glasgow Coma score of 15, and she's in no acute distress. She's able to maintain her own, hold the conversation, maintain attention, no distraction, no memory issues. On assessment, I did check her tympanic membranes, or I did assess her head, normal cephalic, atraumatic. I assessed her eyes, and the conjunctiva were clear with sclera and anesthetic, and the ears, the tympanic membranes were clear, normal findings, and no erythema. The nasal mucosa was pink and moist without significant erythema, edema, or purulent discharge. The throat, oropharynx, was clear without erythema, exudate, or tonsillar hypertrophy. On assessing her cardiovascular, it was regular rate and rhythm with S1, S2, and no murmurs, gallops, or rubs were appreciated. The chest was symmetric with normal percussion. On auscultation, she had scattered rhonchi in the right lower low, but no wheezes, crackles, or diminished breath sounds. The abdomen was non-tender, non-distended. Normal active bowel sounds were present all 4 quadrants. The musculoskeletal system, no joint swelling or deformities, full range of motion in all extremities, and strength was 5 out of 5, symmetric bilateral in upper and lower extremities. Skin was pink, warm, dry, and tagged. No cyanosis or lesions were noted, and the patient is alert and oriented to time, place, location, and just that the cough was bothering her. So after my assessment, that she's having an acute respiratory illness, most consistent with acute bronchitis. My differentials include acute bronchitis. This is my leading diagnosis, given the acute onset of productive cough with green sputum, the presence of bronchi on the exam. And my second differential would be post-viral cough. While possible, the acute productive nature with the colored sputum was less likely at this stage, and then community-acquired pneumonia is the next. But she doesn't have a fever, she's not tachypnic, she's not tachycardic, and her vitals were stable. And then the last one would be the ACE inhibitor due to she's on lisinopril. But at this time, the productive cough makes it less likely and more likely of an infection. And my treatment plan is to she is stable and low suspicion for pneumonia, so I did not order a chest x-ray or get labs, and that I did recommend continuing the guaifenesin every 12 hours, and I did prescribe some the Tessalon pearls, the benzathionate 100 milligrams 3 times a day as needed for the persistent cough. And I advised her to push fluids, to get a humidifier in the room, to keep moving, keep doing what she does daily, and to return if worse. And so if she develops a fever, some shortness of breath, chest pain, those things, I need her to go to the ER, but as well to follow up with me after the ER visit. And the plan is for her to return in 2 weeks, and once if she's not better, then we will reevaluate and get a chest x-ray and some labs.